Hi, everyone. My name is Scott Fishman, and I'm the Jacquelyn Anderson Endowed Chair in Wellness Education here at the University of California School of Medicine. And it's my pleasure to give you this overview on the topic of wellness and resilience. At UC Davis, we are expert in so many areas that touch on this area of wellness. And we've really made the case that a university exists for a well world and to support well people. And this slide that you see here just gives you a sense of the excellence that exists in this university that kind of gave us the audacity to set up an Office of Wellness Education within a School of Medicine that already has an Office of Medical Education. And the idea was really that we have a strategic plan that very clearly expresses that our goal is to transform lives by improving health. The question is, what does health mean? And unfortunately, in the United States and largely across the world, health care has really become disease-responsive care. We train our health professionals to care about the whole person, but really we're training them to be disease responders. And any of you who have had to work with health systems, which is probably most of you, have realized this fact, that when you go to a hospital, they're very much there for you to respond to an illness. But very rarely do you go to health professionals to say, I'm well and I'd like to stay that way. The resources aren't there, the orientation isn't there, and that's what our Office of Wellness Education is seeking to address. We're addressing wellness, which is a difficult word because it's used in many different ways. We believe that wellness has to do with many different variables. It's really, for an individual, what you put in your body, what you do with your body, what you put in your mind, and what you do with your mind. But the variables that go into all of that are as wide as the issues around what to eat, how to think, how to move, social justice, the air we breathe, climate change, etc. It's spirituality and economics and pretty much everything that affects us as an individual and society that impacts our wellness. Our goal as an office is to look at that information, recognize that there's really a sea of misinformation out there, and hopefully provide reliable information that has quality, that can be used to make informed decisions about how to live life, that viewers like you will find it compelling and even life-changing. So that's our hope. That's our hope for the Wellness Academy. And that hope really stems from seeing very discouraging data about the health of our society here in the United States in particular, where we have the world's best healthcare, and yet no matter the state they live in, Americans die younger than people in many other countries. Our statistics for mortality are at the bottom, not at the top where we would expect. And this is a very important thing for us all to think about, because while we have the resources, those resources aren't impacting us as they should. We have the poorest life expectancy of all developed countries. And it's declining even prior to COVID and is clearly tied to increasing burdens of chronic disease, especially diseases that can be prevented, like diabetes, heart disease, chronic liver disease, etc. Even diseases like Alzheimer's. These diseases that can be preventable are all tied to the way we live our lives and the lifestyle choices that we make. And that's what wellness and resilience is truly all about. To continue to give you a sense of the problem, 6 in 10 adults in the US have a chronic disease, and 4 in 10 adults have 2 or more. The CDC goes on to say that 72% of adults in the year 2022 were overweight or obese. 19% of children were obese. 11.3% of adults had type 2 diabetes. And this is the one that I think is staggering, that 38% of all adults and almost 50% of our population over 65 are pre-diabetic. Again, a disease that's very much influenced by the way we live our lives in multiple directions, not just diet, but also activity and stress, etc. This is an article from the New England Journal of Medicine that points out that 60% of 2-year-olds in the United States are on course to become obese by the age of 35. So why is there such a lack of wellness? What is the cause? And I would argue that the cause is that we have a low priority on changing our lifestyles before we get ill. There's really no expectation that healthcare students prioritize preventing care, and that health systems prioritize preventing disease as part of their scope of practice. On top of this, as I said before, we're living in a sea of misinformation about prevention because, we're a libertarian society in the United States, and rightly so. People get to make a decision about how they want to live their lives, and that shouldn't be taken away from them. But unfortunately, there's not a lot of information to make truly informed decisions because of the state of the media and the information that's given to us through the media and other sources that usually have a financial connection to them or some conflict of interest in terms of the perspective that those sources are driving the information through. Essentially, most of it is people trying to sell us things that are far from proven. The problem of chronic disease is one that is multifactorial, and that's a problem, but it's also actually a positive because it not only affects one part of our existence, but it affects our biology, our psychology, our sociology, our environment, and that gives us a lot of leeway in terms of how we live our lives and the effect that we can have with small changes on lifestyle, with great changes on outcomes. Now we think about what is it that we can change in our lives? And a lot of it is non-modifiable. You can't change your age, your cultural background, your socioeconomics sometimes. You can't change the trauma that we've all had in life, some much worse than others. And for a long time, it was thought that we couldn't change our genetics, but there's some new research that suggests otherwise. But there's much in terms of lifestyle that we can change that is modifiable, like our mental health, our weight, our sleep habits, our diets, our activity levels, occupation, and many, many other variables that affect chronic illness. Mental health is one of the most modifiable ones, and yet one of the areas that we're increasingly affected by. The data on mental health issues amongst Americans, including our young adult females and some of our older individuals in our population, are staggeringly concerning. We know that anxiety and depression is prevalent, and it affects all chronic diseases. There's this bidirectional relationship. You say, well, what caused the chronic disease? Was it the chronic disease that caused the anxiety and depression, or the anxiety and depression that led to the chronic disease? And I would say the answer is yes. They both do. And effective treatments usually require addressing both sides. There's a huge literature out there about, the strength that we have in terms of affecting how we think and what we think. This is some work from Jon Kabat-Zinn that many of you may have heard of, and maybe some of you haven't. He's a pioneer of work that was done 5,000 years ago, or began around the idea that we have great control over our thoughts, and yet many of us don't think we have any. The kind of the runaway worry and anxiety and fearfulness and things of that sort that happen without our even being aware of it, we know can dramatically affect our state of wellness and predispose us to chronic illness. And this has been the focus of Jon Kabat-Zinn's work around the idea of mindfulness, which is really, I would characterize as intentional attention to our thoughts. And when we learn to do that, and it's a learnable process, we then start to see that we have thoughts that we can control. You can't control them until you become aware of them. Thoughts that we're not aware of otherwise, and that when we do that, we feel better in many, many ways. This is actually a study on mindful meditation and pain by a colleague, Fadil Zadon, who's now at the University of California, San Diego, and where he looked at images with patients who were in pain, and they used this mindful meditation, this intentional attention practice. And what they found is that patients who were in pain were able to control their pain in ways that they had never been able to control it before, and that even some of them were able to use this practice to reduce or eliminate their pain medications. We also know that physical activity can impact our mental function. We know that exercise is possibly the most potent, or one of the most potent antidepressants, anti-anxiety interventions, etc. And we also know that physical activity affects all the other parts of our physical needs for blood flow and strength and flexibility and immunity. I would say blood flow, strength, flexibility, and immunity are really the core pillars of resilience. And resilience is what we need to both fight off the stressors that can harm us and make us open to the things in life that bring us joy and fulfillment. We know that sleep is important for both mental health and physical health, and yet a large minority of Americans don't sleep well. And we know that sleep disorders, like many other chronic problems with lifestyle, also predispose to major chronic illnesses, both physical and mental. We know that diet has a big part of it. And if you look at the internet, you'll find hundreds of different things that you should eat or shouldn't eat. It's pretty wild. But this is a quote from Dr. Fred Tabang from the School of Public Health at Harvard. And he says, your diet can help support your immune system by having it turn on and turn off at the appropriate times. Yet a poor diet can alter your immune system, so it acts abnormally and can contribute to persistent low-grade inflammation. This is probably the core driver of how a poor diet will perpetuate chronic illness, and how a good diet can prevent it. We'll talk more about diet, but and what to eat, because once you buy that statement, then the question is, what should I eat? And there are some answers. The good news is it's a pretty wide menu of what to eat, but we're pretty clear about what not to eat, and we'll go into that in just a bit. I also mentioned that genetics is an area where it used to be thought that genetics was a non-modifiable entity, that you couldn't change your genetics. And now we know that negatively genetics are affected all the time. That you should wear sunblock when you're in the sun, and the reason is that UV radiation can affect our genes. We know that chemicals can affect our genes. We know that toxins like cigarette smoking can affect our genes, and viruses, etc. These are commonly known. But what about genetic change with lifestyle? So this is probably the largest study I know that addresses this issue. Over 55,000 patients who had cardiovascular disease with major genetic risks for the disease they had. And what they did was look at a healthy lifestyle that included not smoking, not being obese, being active one time a week, physically active just one time a week. And then a relatively healthy diet that was higher in vegetables, fruits, nuts, etc., than it was in meat and refined carbohydrates. But it included all of the above. And what they found was that people who had 3 out of 4 of these variables, not smoking, obesity, exercise one time a week, and a relatively healthy diet, had 50% fewer coronary events than the people who didn't. This is again, a 50% reduction is quite dramatic when you look at this, and you have to wonder what's going on with the genes. And just like when the genes are harmed by external sources like UV radiation and chemicals, etc., we look at not the genes themselves, but the protectors of the genes. And these are called telomeres. They're structures that actually protect the surface of the genes at their extremes. And it's really interesting to look at these, because when you look at studies of telomere changes in people who have changed their lifestyle, what you find is that these protectors are increasing with increased lifestyle, with the application or the practice of lifestyle changes that support wellness. And they actually get less robust with lifestyles that aren't preventive and aren't wellness oriented. This is really a dramatic finding, because it not only explains really in many ways the process of potentially aging, but it gives us a biomarker of looking at the impact of a healthy lifestyle as a form of resilience. These are protectors of the coding in our body that produces the kinds of changes we need to stay healthy and strong. And when they are injured, they expose the chromosomes to be damaged, and then the chromosomes no longer can do their work. So this is a study of men with biopsy-proven low-risk prostate cancer, a 5-year follow-up of these patients. And they looked at, this is a Dean Ornish study from the University of California, San Francisco, and they looked at healthy lifestyle changes. And again, what they found was the patients that made lifestyle changes, they increased the size of their telomeres, the protectors of the chromosomes that made the chromosomes look like younger chromosomes. And those who didn't make those changes actually had shorter telomeres, and telomeres that looked older at age, or telomere sizes that would correlate more with people of old age. Now, there's a lot in the literature about this, and you'll see a lot of news articles on it. I would argue that this is far from proven science, but it's very, very compelling, and we're going to need more research to really understand it. But this is a key area of finding those biological, measurable signs that lifestyle change that's positive and wellness-oriented can absolutely reduce risks and make us more resilient as people, to be active, to have less disease, and to have longer lives. Now, this is work that was done by Liz Blackburn, who's a Nobel laureate geneticist, and Alyssa Epel, who's a the world-renowned psychologist who looks at the psychology of wellness as well. And again, what they found is that worn telomeres, these protectors of the chromosomes, increase pretty much, when they wear out. It's associated with the onset of all sorts of chronic diseases. And that, telomere shortening is consistent with aging. Stress will shorten chromosomes, or excuse me, I should say shorten the telomeres and expose the chromosomes to risk. And that stress reduction modalities will prevent that change from occurring. The same thing happens with exercise, and we see the same with whole food diets as well. Again, the key there is the avoidance of ultra-processed foods. The timing of it is that, it's the change is seen in as little as a few months, but long-term changes can occur in over a year to 10 years, which are clearly then associated with changes in health span, meaning less disease, higher quality life, and longer life. And, I said that, diet will help, exercise will help, and mental resilience will help. All of them together is probably the best mix. And, at the end of the day, that's really the recipe that we find for all of these chronic illnesses. So it's actually so complicated at this point. It's actually simple. When we look at wellness, we know that that there are basic things that we can address in our lives that can be transformative for us. Wellness, as I mentioned before, is a word that is clearly defining of the space of the other side of healthcare. Healthcare should really be being well, staying well, and when you're not well, responding to illness. But really, it's responding to illness in terms of major Western medicine, and we're trying to add that other part. Now, wellness is a word that's unfortunately also been capitalized, monetized, and used for many, many other purposes. It seems like everyone is for wellness, but very few agree on its meaning. And many don't follow through with it. So this is a World Health Organization survey where they asked people, do you believe being physically active is important and beneficial? And what they found was 9 out of 10 respondents said yes. Then they said, are you currently physically active? And only 2 out of 10 said yes. So, you have to ask yourself, what's wrong with that? What's wrong with this? That we actually know that this is good for us, but we don't practice and follow through. And again, you have to look at the information that we're getting. This is just demonstrates some of the, stuff that's coming at us all the time that usually has some secondary driver. I'd say most of the time, somebody's trying to sell us something or convince us of a point of view. It's gotten to the point where the Surgeon General has gotten involved and made a public announcement that health misinformation is a serious threat to public health. It can cause confusion, sow mistrust, harm people's health, and undermine public health efforts. So this is a serious problem, and it's a problem that's been looked at widely by many, particularly in the area of disease-oriented medicine, but now more around the issue of how should we live our lives so that we live higher quality lives, so that we have less disease, and that we live longer and happier lives. So the question then is, what do we do? And it really comes down to a simple grouping for most of it, not all of it, but the vast majority of the decisions around activity, movement, what we eat, the food and fuel we put in our body, and then managing our thoughts and emotions. One question is, should I move? The answer is yes. If you don't move, there are all sorts of problems. So we know that sedentary behavior is proportionate to all sorts of risks from chronic illness and death, cardiovascular, type 2 diabetes, many different cancers. And we know that when we move more, we reduce our all-cause morbidity. We lower the risk of cardiac diseases, hypertension, diabetes, lipids, cognitive function improves, and we lower risk for cancers even. This is increasingly documented in our science. It's really quite dramatic that we can improve our quality of life, reduce anxiety, depression, improve our sleep, lose weight, or at least optimize our weight. I hate to focus on weight as a problem in and of itself because we all have different weight set points, but get to an optimal weight. Physical exercise certainly can help with that. It makes us stronger with our bones and our muscles. It improves physical function in almost every way and lowers risks of things like falls or related injuries, and increases the chance of living longer, decreasing increasing the risk of living longer if we're not healthy as well. So, with that, there's plenty of evidence to support what I just said, but an emerging data set on the impact of exercise on dementia and things like autism, which is very, very encouraging and fully expected based on what we know. There are many types of activity. I just put dancing up here because it's one of the few activities that actually call for social connectivity unless you're going to dance alone. It requires cognitive function. It requires physical coordination and strength. And it also involves multiple sensory systems. So if you wanted to look at one exercise to do, dancing's a good one, but there are many, many out there. The bottom line is the Department of Health and Human Services has made recommendations on physical activity. I think these are really the minimum, that we should have 150 minutes of activity a week. That breaks down to 2.5 hours per week, about 20 minutes per day, or 30 minutes 5 times per week. And then 2 days a week of resistance exercise. Resisting gravity and strengthening muscles and bones are really critical. Again, my feeling is that once you do this and you feel comfortable with this, you'll actually have the capacity to then think about even doing more. And that's where most people get after they engage in a thoughtful activity program in their lives. The other big thing is, what should I eat? This is the puzzle of opening the refrigerator. We know that healthy eating patterns reduce all causes of mortality and death in the United States. We also know a lot about what not to eat. And this is a 2024 article that just came out in the British Medical Journal that speaks to the fact that ultra-processed food is really the enemy, and greater exposure to ultra-processed food was associated with a higher risk of adverse health outcomes. So with that, what should you eat? Well, there are many, many diets out there that have been associated with health. The Mediterranean diet is probably the one that people have heard of the most, largely because it's the one that's been studied the most. I want to stress to you that there are many good diets out there. It's not just the Mediterranean diet, but the Mediterranean diet is quite a delicious diet and a great basis for what to eat. But there are just many, many different ways of eating. And we know that people from all over the world who have very healthy lifestyles, live a long time, don't have a lot of diseases, and are very happy with their lives, eat a multitude of foods, not just the Mediterranean diet. So there are many ways to look at this. But the Mediterranean diet has been shown to affect things like Alzheimer's and dementia. Again, this just gives you a sense of, many different ways of looking at it. I think really it's a function of, if you look at eating whole food, and you look at food that doesn't have chemicals in it, food that hasn't been processed largely, so it doesn't come out of a box, um, doesn't have a lot of preservatives, is a great start and gives you a lot of options. So I like Michael Pollan's quote, which is, "Eat food." Food is something that your great grandmother would know all the ingredients in it, as opposed to what might be on a box of cereal today. Don't eat too much, and eat mostly plant-based diet, but that gives you a wide range of eating a multitude of foods. Um, but but again, we know that a plant-based diet, at least in part, and that's a whole food plant-based diet, has tremendous health benefits. I think it's possible to be a vegan and eat only plant-based food and have a terrible diet, though. If that's processed food, we hear about the Impossible Burger. The Impossible Burger is probably the most processed food I can think of. So I don't think that's health food for people. It's health food for the environment, however, and that's why it was developed. But now it's being rethought about making it a product that is healthy for our environment to be produced, but also healthy for people to eat. So the other part is what to think, and how do we manage our thoughts and our stresses. This is a book by Alyssa Epel, who wrote The Stress Prescription. She also was the co-author of The Telomere Effect. And in this book, she talks about the fact that stress is inevitable. It can't be avoided. Some people can handle any kind of emotional stress that's thrown at them, and some people can't handle much at all. And there are a lot of variables around that. The key is, how do we make ourselves as resilient as we can to be able to handle the things that are going on in our lives? That's when people have quality lives. With that, there's an epidemic in the United States right now of dissociation socially and loneliness. And this is actually a advisory from the Surgeon General. Very rare that they do these national advisories. So this was one of the recent ones on the devastating effect and really the epidemic of loneliness and isolation in the United States. This got much worse during COVID, but still continues to be a very, very prevalent problem. And I would say this is one of the key drivers of anti-wellness or an unwell life. This is actually one of the largest studies that's ever been done on the area of happiness and wellness. It's a study that started in 1938 with 724 participants. They were actually Harvard undergraduate students, as well as boys from disadvantaged and troubled families in Boston, comparing the two. And they followed these folks for over 85 years and their descendants. And what they found is, I think, something that is really important for people to know, that stronger relationships predicted happier, more satisfying, and healthier lives. And that the strength of our social connections with others predicted healthy bodies and brains as we go through life. It was found that the strongest social bonds and connections in the ages during the 50s, when we're 50 to 60, predicted happiness and contentment well into the 80s. And this included friendships, clubs, romantic attachments, family attachments, different kinds of groups, religious and otherwise, sports partnerships. I could go on and on. But we think of these things as nice to have things in life. They really need to have things. And I want to stress what the author, the current director of the study, said in this book, The Good Life, which is, we learn that people believe happiness is something they can achieve. If they buy that house or get a promotion or lose enough weight, then happiness will follow. We act as if it is a destination that we will get to if we tick the right boxes. But the data clearly shows that this is simply not true. And that's a good thing, as contentment is no longer something out of reach, but eminently achievable by all of us. So bringing this all together, The wellness conundrum is one that I think we should all think about. But I think that we'll find that it's so complicated in many ways. It's very, very simple. And this is shown by this area called the blue zones. You may have heard of the blue zones. These are areas of the world where people were found to live lives where they had lower amounts of chronic illnesses, they lived longer, and they had happy, fulfilled lives. And these were areas, this map will show you, in the United States, in Europe, Japan, South America, etc. And if you look at the blue zones, unlike the science that I have presented to you today, what we find is that there's not a lot of science. These are just observations. Now, the data may be there, but the data hasn't been released. And one of the problems of the blue zones that I find is that it's being monetized now, and there are documentaries on it, which are very, very good and appropriate. But my worry is that unless we can see the data, it's hard to know what's really true. But the observations are very compelling, that when you look at all of these areas, all of these different parts of the world, which they're finding even more of now, there are some things that are consistent about what these people do. And one of them is that they move naturally in their lives. They don't have to go to gyms to bring activity in because they walk to work, they walk to places, they're constantly in motion. They have lives that are purposeful and meaningful, and they're able to shift away from work into family life. They eat food that's largely like what we talked about before, largely whole food, plant-based. They don't overeat. Most of these areas, not all, consume alcohol. What's interesting is the alcohol consumption is modest, and it's used to associate with their community. It's used during meals or for community activities, as opposed to alcohol abuse in other non-well societies where it's used for dissociation. And I think most importantly in these communities, what we find everywhere is this sense of belonging, that they have family nuclei, whether it's the kind of traditional or untraditional families, and that they have communities that support their wellness. So when we think about what we might do in terms of a well life, I think we should all take that to heart and think about, do I live a life where I feel purposeful, connected? Do I live a life where I feel that the fuel that I put in my body is making me better or worse? And think about the wholeness of that food and the possibility of that change. Am I as active as I can be in a way that could help me prevent serious chronic illnesses? Or if I have those illnesses, will help to dial them back. In the case of things like diabetes, we know that activity and diet and stress management can actually reverse the chronic illness. So, again, my point to you is that there's no one way. And the beauty of it is that you have choices to make that are really vast. We're not very few of us are stuck, although some of us have more resources than others. But I would say it's really about being open to change. And for some of us, really forcing ourselves to change in one way or the other. I don't think you can do it all at once. And I don't think that you can live a life without changing, because change is happening anyway. So my suggestion is get on board. Think about these areas of your life that you can address in terms of how I eat, how I move, how I think, and how the world around me and the stress that I have affects me, as opposed to just getting rid of the stress. We go to gyms to exercise, and we're actually adding stress to our lives because stress is actually necessary. Physical stress is necessary. And what we're finding with cognition is that we need to stay active. If we reduce all the stress around us, it's probably not good for our minds. And then we need to think about the connectivity that we have with others in our world. And look at how our social situations, how our homes and our work lives lead us to either isolation or association. So with that, I thank you very much for your attention. My last word of advice is think about where you are and start there. And thank you.